Saketh, and good evening for us. This is a cervical cancer month, and we just wanted to do a short podcast on this. And Dr. Saketh is from USA, from Denver, and he's going to give the perspective from the Western perspective. And Dr. Pushpalatha, very senior gynecologist in Hyderabad, and she'll tell us about the problem here. Good morning for you, Dr. Saketh, and good evening for us. Um, this is a cervical cancer month, and we just wanted to do a short podcast on this. And Dr. Saketh is from USA, from Denver, and he's going to give the perspective from the Western perspective. And Dr. Pushpalatha, very senior gynecologist in Hyderabad, and she'll tell us about the problem here. So I just want to ask you exactly what is cervical cancer? Where does it occur? You want to elaborate?
Sure. So the cervix is the bottom of the uterus, and that's actually what opens when a woman is pregnant and she has a baby. And the cells of the that line the cervix, one of the things that can happen to them is the HPV virus, which is a very common virus that all of us
And
are
that is a
exposed
human
to.
papilloma virus, HPV?
Human papilloma, yeah,
Okay.
human papilloma virus. It can attach to the cells of the cervix. And unfortunately, what happens is in a small number of women, maybe just 5% of women, they're unable to clear that virus or fight that viral infection. And then what happens is that virus begins to grow and it causes changes in the cells of the cervix, which
It's a chronic
ultimately can cause
inflammation
both.
that is triggering?
Yeah. Yeah, it's
Okay.
a chronic inflammation, but ultimately it causes precancer and cancerous cells to develop in the cervix in a very small number of women.
So what is the, in order in women's cancer, what number is it in US?
So in the US, it's probably the least common GYN cancer or women's cancer. Endometrial cancer or uterine cancer and ovarian cancer are far more common. But in other parts of the world, like India, in Africa, and Southeast Asia, cervical cancer is actually the most common. And the main reason for that is because we
Let
don't.
me bring in Dr. Pushpalatha. Can you share your experience from India? You've been practicing for 50 plus years.
Yeah, in the last few decades, there has been a lot of research taken place and a lot of improvement in the diagnosis, treatment, and approaches.
Prevention,
And
yeah.
this is the second most common cancers in women
India.
in India.
So, when a cancer affects a woman, it is really catastrophic, and, it affects the entire family, the children, and the entire society. So what are some of the risk factors, Dr. Saketh, from that side? And I'll ask her as well.
Well, the risk factors are probably very much the same. Increased number of sexual partners can increase your exposure to HPV and ultimately
The number of
increase your
years
risk of.
you're as well, right? The number of years you have
Correct.
sexual relationship.
Or early age of having interrelations, number of partners, that type of thing. Other risk factors is smoking is a very, very big risk factor for cervical cancer, as is having any type of problem with your immune system. So if you are on things like steroids or medications to suppress your immune
Immunosuppressant.
system, yeah, or if you have, immune-related diseases like HIV and things like that, those are very big risk factors for the development of cervical cancer.
And what about in India? Sometimes women get married very early or.
Yeah, they get married early, and main thing is lack of education and the nutrition status and the lifestyle, like regular exercise and all that may not be there. All this play a major role.
So since you
And then
brought that up, I just want to ask, what are some of we talked about risk factors. What are some of the preventable? What can a woman do, on both
main
sides?
it is awareness, awareness of the disease. And then earlier symptoms are like some discharge or pain in the abdomen, dyspareunia, that is when they have pain during intercourse, or loss of weight.
So they should seek medical advice. What about this lifestyle we're talking about, like, balanced meal, more vegetables? There's a lot of studies that have shown that it's protective. What's your impression?
So I think for cervical cancer, healthy lifestyle is very, very important. So don't smoke. If you're going to have intercourse, you should, use protection and things like that. I think are probably two of the biggest ones because that can prevent HPV infection, and smoking ultimately can actually make HPV worse. So, those are some lifestyle things. And then from a nutrition point of view, obviously healthy lifestyle, eating well, eating, foods that are not particularly carcinogenic or things that cause things to have cancer would be some
I mean,
things
in
that
the
I would
Western
say. So low
countries, the high red meat and high fat and highly processed food is also, very common, which I see is catching up in India as well.
Even in India,
That seems.
urban setup is there. Everywhere it's percolating.
So I think that's
Yeah,
something a woman who has control of the kitchen should be able to,
right.
feed the family as well as her. What
Right.
about, since it's a viral infection, chronic viral infection, what about any of the, are there any vaccines? And yeah,
Sure.
can you elaborate on?
So So the most interesting and I think amazing thing about cervical cancer is it's completely preventable. We now have a vaccine to actually prevent the development of cervical cancer. It is available all over the world. It's available in India, available, pretty much everywhere. And really, when a woman gets vaccinated, sometimes you need two, sometimes you need three, depending on the type of vaccine that you get. The vaccine has a 90 to 95% chance of preventing both precancer and cancer of the cervix. So,
So once they
I would
take it,
strongly
let's say around before they have, active sexual life, if they take it, they don't have to take again. Is that correct?
correct. It's just given over, a certain period of time. You get
Usually
the
like in
vaccine
teenagers,
dose.
or when do you give it in US?
So, so it's indicated for women between the age of 9 and 26 right now. There is even some data to show that the vaccine may prevent it or certainly help precancerous cells regress or go away if you use it even outside of that age group. But, that's the indication in the United States is between 9 and 26.
So I want to ask you, in India, we don't even see polio, diphtheria, all of them have been eliminated because government has really taken control and they reimburse and actively promote. What about this vaccine?
Even here, there is more awareness of the diagnosis. The government has taken it as a project.
For the
And
vaccine, you mean?
yeah,
Yeah.
for the vaccine. And there is education in the education institutes. There are programs which are taking place. Early diagnosis like pap smear, HPV test and all that. More
So the
awareness
vaccine is covered by the government programs?
some of them, some of the governments, state governments have taken over.
Okay. So what is the acceptability? I know that in both the US as well, on both sides of the um, uh, on both sides of the globe, there is a concern about vaccine. We've seen it with even COVID vaccine. The acceptance was in some states like 60% in US. So
Sure.
what about this? I mean, this is entirely like there's no threat like COVID, So it's something that might come years down the line. So what's the acceptability in US and India?
Depends.
So, unfortunate, yeah,
Yeah, go ahead, Saketh.
yeah. Unfortunately, the uptake of the cervical cancer vaccine has been very low in the US, only about 30%, maybe 40% at its highest, more, actually quite lower than that. In places like Australia, the uptake is, you know, 80, 90%. They've almost eradicated cervical cancer in that country because of vaccination programs. But the vaccine is safe. It's been given to millions and millions of women around the world. It is a safe vaccine. We've seen very, very few side effects from the vaccine, other than some minor pain at the injection site. But the vaccine is safe and it's effective in preventing, what can be a very bad
I was very
cancer.
surprised to hear that low acceptability. Maybe there's no immediate threat, so they're not really, under a threat to take it. What about in India? How is
Right.
it
Same
acceptable?
thing. It's awareness. Social media is playing a major role. So those because TVs are everywhere, even in the remote corners. So now public are slowly they're
So
getting.
do they come and ask you in your practice, can we
Yeah,
get the
they
vaccine?
do. They do
That's
ask.
good. I mean,
And
yours
they
is a
try
little
to
bit educated class, your
Mhm.
patients, so they're different. But do you think generally there's acceptability?
Generally in schools they're trying to have a awareness classes for the teenagers. So they go home and they may tell.
Excellent. Um, What about like pap smear and, regular pap smear?
Right.
What's the
So
recommendation?
we do. Yes, so the recommendation is to get screening for cervical cancer. We generally start in the United States around the age of 25 because we know that a lot of women will be having intercourse earlier than that, and most of them are going to clear the virus. So we don't want to, unnecessarily screen a low risk population that's going to clear the virus because that can cause unnecessary interventions. So we do recommend PAP screening. The guidelines continually change. Now we're moving more from PAP testing and PAP screening to more HPV testing and just testing for the presence of what we call a high risk HPV virus. I think that that's the way that we'll go in the future, for all of this type of testing. But right now, certainly in India, I think we would recommend PAP testing. That's something that happens at 1 to 3 year intervals, depending on your age group, and even up to 5 year intervals, and your healthcare status and your medical problems that you may have. So important thing is to talk to your doctor about it.
Pap smear, people are coming regularly.
Now we recommend HPV, like visual examination. Acetic acid test is recommended.
HPV.
Now. That is recommended. And pap smear is also.
Okay, so once you diagnose maybe very early cervical cancer, what is the prognosis with treatment and everything?
So early stage cervical cancer is in fact very treatable. You generally, if it's a very early stage, we generally do surgery, radical hysterectomy. If it is a little bit more advanced, we'll recommend chemotherapy and radiation. Again, cure rates for early stage cervical cancer are 80-90%. Cervical cancer treatment in India is excellent, very well developed, top of the line treatments are available. If it's very advanced, it's spread outside of the pelvis, then we generally will use chemotherapy to treat those patients.
And here as well, the prognosis is excellent.
Depends on the when we
Stage
diagnose.
of cancer.
Earlier the better.
So the best thing is for the woman to take control of her body and eat well, exercise, not smoke, not engage in high risk behaviors. And then if there's any change, then you seek medical advice. So your chance of being cured is very, very high. So that's very encouraging. I know when I went to medical school here, we used to see a lot. I'm sure, the incidence may have come down, but with the vaccine, I'm sure there will be a change in the occurrence of cervical cancer. That's excellent. It's a very good news about the vaccine and the awareness. And I'm very happy to learn about that. Thank you.
Thank you.
I go to work.
I will.